Okay, we're going to be doing med administration this morning, and so I'm going to be this is going to be the first part of preparing, getting our meds, getting ready to start giving meds. So the first thing I'm going to do is I'm going to go to the, I'm in my nurse's station, and at the beginning of my shift, so I'm going to be comparing and making sure that I'm verifying that my MAR is going to match my doctor's order. So I've got Smith Brad, date of birth 4/24/1957, allergies to codeine, and our admission diagnosis, uncontrolled diabetes, right otitis media, conjunctivitis, infection from diabetic ulcer, pain, congestive heart failure, asthma, and nasal congestion. And my patient's 6 foot, 256 pounds, medical record 54321. So I want to go over to my medication administration record, and I've got Smith Brad, date of birth 4/24/1957, allergies to codeine, uncontrolled diabetes 2, right otitis media, conjunctivitis, infection from diabetes ulcer, pain, congestive heart failure, asthma, and nasal congestion, 6 foot, 256 pounds, and medical record is 54321. So that matches between my doctor's orders and my MAR. So I'm going to go back to my doctor's orders, and I'm going to start verifying one med at a time between the MAR and the doctor's orders. I read the admission diagnosis, so as I'm reading my medications, I can verify that the reason the patient's getting it, is there admission or is there a diagnosis that fits why they are getting that. So we're going to start with the first one. So I have Smith Brad, 4/24/1957, date of birth, and I have NPH insulin 5 units subcutaneous AC. So I'm going to go over to my medication administration, and I have Smith Brad, date of birth 4/24/1957. I have NPH insulin 5 units subcutaneous AC. AC means before meals, so I should have 3 times. I have a 9 o'clock, a 12 o'clock, and an 1800. So the times match the times on this, and this matches my doctor's order. So I verified that one. Go back, and I have Smith Brad, date of birth 4/24/1957. I have digoxin 0.125 milligrams PO daily. Hold if pulse is less than 60. And go to my MAR. I have Smith Brad, date of birth 4/24/1957. I have digoxin 0.125 milligrams PO daily. Hold if pulse is less than 60 beats. It's daily 1 time, and it's scheduled at 9 o'clock. So that is correct. The time matches this, and this matches my doctor's orders. Go back. Smith Brad, date of birth 4/24/1957. I have Rocephin 1 gram reconstitute with 2.1 mils of 1% lidocaine for a final solution of 350 milligrams per meal. Give 350 milligrams of final solution IM BID. Okay, I'm going to go to my medication administration record. I have Smith Brad, date of birth 4/24/1957. I have Rocephin 1 gram reconstituted with 2.1 mil 1% lidocaine for a final solution of 350 milligrams per meal. Give 350 milligrams of final solution IM BID. BID's twice, so I'll have a 9 o'clock and an 1800. My times match the order here, and then this matches the physician's orders. It's verified there. Smith Brad, I'm back at my physician's orders. Smith Brad, date of birth 4/24/1957. I have tobramycin eye drops, 1 drop in left eye daily. Go to my medication administration record. I have Brad Smith, date of birth 4/24/1957. And I have tobramycin eye drops, 1 drop in left eye daily, so just 1 time, and I have a 9 o'clock, so my time matches that it's daily, and that matches my doctor's orders. Go back to my physician's orders, and it looks like that was all of my medications. So I'm going to go back to my MAR, And up here where it says verified, I am going to put my name and initials and my credentials, or my name and my credentials, so they know that we know that this MAR has been verified and it is correct with the doctor's orders. So I have J. Buckskin for MSN RN. You would put your first initial, your last name, and then your credentials according to which school, nursing school that you're in, okay? So once I have done that, this is the first part of getting ready to do our administration. So now I'm gonna go ahead and close out my computer, okay, at the nurse's station, and I'm gonna get ready to go to the medication room.